ABC Medical Correspondent Dr. Jen Ashton joining me now from New York to talk about the latest on the vaccines. Dr. Jen, over the last year, we've gotten a lot of information that has changed as weeks go on, right? And now with vaccines, what's the best guidance for those vaccinated in regards to being around the other people who are not vaccinated?
Well, we just heard some new guidance from the CDC on that just in the last week, and it's a perfect example of how real life is catching up to science, not the other way around, because the pace of this scientific discovery and advancement has been so extraordinary. So what the CDC said is if both parties, let's say two people, have both been fully vaccinated, they've waited 2 weeks after their second dose, they can congregate in private indoor environments, so they could go to each other's house for dinner without masks, without social distancing. They also said that if someone has been vaccinated, that they could get together with a low-risk group in some indoor settings, again, in a home environment, and not have to wear masks or distance, as long as the people who are not vaccinated are at low risk. So this is an example of how really the concern here is about others, not so much for ourselves when you talk about our behavior after vaccination. They still haven't come out with travel guidelines yet after vaccination, but we do expect that in the future as well.
Yeah, and a lot of people are trying to make some travel plans with spring break coming up and some of the holidays with Easter and whatnot. Let me talk about efficacy with these vaccines. There's somewhat of a debate, not like people have a choice of which vaccine they're going to get. Most people are just very happy they're getting one. But the efficacy for Johnson & Johnson versus the Moderna and Pfizer?
Well, I'm so glad you asked that question, because the difference in those numbers has really gotten kind of a bad PR reputation right out of the gate. And that's because I think there was confusion about how to interpret those numbers. So remember, Johnson & Johnson vaccine, 85% effective at reducing the risk of severe illness, 100% effective at reducing the risk of hospitalizations and deaths. Compare that to 94, 95% with Moderna and Pfizer. They are all great, safe, and effective vaccines. We do not have to have the exact same number for a vaccine to save lives and help our society open up again. And if you look at the 2-dose regimen vaccines, after 1 dose, if you wait a little bit, you get up to about 85% efficacy, which is exactly what Johnson & Johnson is for severe disease. So they are incredibly comparable. Yes, they have some differences, but at this point, if I had not been vaccinated at my hospital already, I would take any vaccine that I could get.
I have spoken with the editor-in-chief of the New England Journal, and he is talking about some newer vaccines that are coming down the pipeline. Have you heard anything in any of the companies that are ready to roll any new vaccine out in the coming maybe month or two?
Probably not that soon in the future, but absolutely we have to remember that there are, over 40 vaccine developers in active phase 3 clinical trials worldwide, and many, many more that are at various stages, including a nasal spray vaccine that's in phase 1 clinical trial. So we should and will expect to see others. It will not just be 3, and that's what we need, not just in this country, but worldwide, because remember, this is a global pandemic as we sit on the 1-year anniversary of that milestone. And so the whole world needs this vaccine or a vaccine. And the more technology and options we have in terms of logistics, the better for everyone.
We have plenty of reason to be optimistic in the coming weeks and months because of the vaccines that are coming out and the ones that are already on the market. There are other silver linings as well. I recently read someone's Facebook post, I think it was on ABC's Facebook, about how there's been so much doom and gloom around this pandemic, but there are some good things that have come out of it as well. I'd like to focus a little bit on some of the good. Where do you see some of the positive?
Well, listen, I have a whole chapter on the silver linings of this pandemic in my new book, The New Normal, which was just came out. And I think it's so important to really sit with those silver linings and understand that with any situation, not just in medicine and science, but in life, there are different ways to look at it. And in terms of silver linings, a real augmentation of our technology and our IT systems, I can guarantee you that will come out of this. We were unprepared largely from an IT standpoint for this type of pandemic. Redundancy in our pharmaceutical supply chain so that we're not as reliant on materials and drugs coming from China and India in the future, that will come out of it. How we live with animals in agriculture, because so many of the pandemics emerge in animal species. And then just human resilience. What we've seen with our own neighbors and our own families and communities, that is the biggest silver lining. So I think that we will come out of here understanding what our mistakes were, but also becoming better prepared and more resilient in the future.
Speaking of your book, The New Normal, we will put a link to it with this interview on our website as well. Dr. Jen Ashton, I always appreciate your time.
Oh, thank you so much. Be well.
And we'll be back.